Look, I just want to follow up my colleague Senator Canavan's remarks on not approaching this in a very scientific way. A lot of the data we've been given so far is basically numbers on a spreadsheet where it's been crunched in various methods, and being an accountant myself, I know that you get garbage in, you get garbage out. I come back to this report, the COVID-19 register, that is actually looking at people diagnosed with COVID-19. Are you testing the quality of the diagnostic tool that was used to diagnose people with COVID-19? So both the PCR test and the actual RRAT tests, noting that 9,970,000 people were diagnosed with COVID from January 22 to through to September 22. So most of these people that caught COVID were already vaccinated. So can these diagnostic tools distinguish whether or not someone had a condition because of the vaccine or because of the virus?
So just to clarify, I think I'm understanding your question correctly. What we have is the information that comes from the notifiable disease system, which comes from the different information systems in each of the states and territories as to whether people were diagnosed with COVID or not. That will be one source of information we'll be looking at. We will also be looking at information as to whether they were hospitalised for COVID or in intensive care for COVID.
Okay, so you're just taking it at face value that if they're diagnosed with COVID, that's it. So when you say you're going to engage other external researchers, will these people be performing pathology tests and histology tests to actually look at the tissue sample of the people that passed away to look for the presence of either vaccine spike protein, vaccine lipids, and whether or not their condition was caused by the codon optimisation or the transfection that the lipids caused?
No, there will be no research like that.
Okay, because that's what I mean by the scientific research, is that we actually got someone with a biochemistry background, or a pathologist or histologist, who are actually looking at tissue samples.
No, so we'll be looking at the information that's already been provided.
So that'll be provided via a spreadsheet or a database, numbers on a database, rather than the actual content or the actual pathology tests or anything like that.
That's correct.
Will you be getting autopsy reports to validate the numbers that you've been given on the spreadsheets?
No.
Okay, thank you. That's all. Thank you, Chair.
Authorised G. Rennick, LNP Chermside.